All these are clues in the exam for you to diagnose what? Carbon monoxide poisoning. Patient will be hypotensive. So we know in hypotensive patients, what is the initial management of choice? IV fluids. And you will be sure which class of hemorrhage or which class of shock the patient is suffering from. Then comes the blood loss. You will be given some of these criteria and you will be asked that what class of hypovolemia or what class of shock is this patient having, or you will be asked that how much blood has the patient lost approximately. Either you will be asked to classify the stage of shock, or you will be asked about the amount of blood being lost during shock. So how do we remember? How do we memorize? Shall we memorize the whole table? No. Let's see. What do we do? At first, look at the blood pressure. If the blood pressure is normal, you will omit class 3 and 4 directly. If the blood pressure is decreased, you will omit class 1 and 2. First of all, remember the blood pressure. Class 1 and 2, blood pressure normal. Blood pressure decreased, that means this will be class 3 or 4. Okay, now look at the pulse rate. This is the easiest one to remember. Look at the pulse rate. Less than 100, 100 to 119, 20 to 39, more than 40. Less than 100, more than 40. This is our diameter, 100 to 140. Second one, 100 to 119. Third one, 120 to 139. Okay, so at first look at the blood pressure. Blood pressure will automatically deduct 2 options from your choice. Then look at the pulse rate and you will be sure which class of hemorrhage or which class of shock the patient is suffering from. Then comes the blood loss. You might be asked what percentage or which amount of blood, usually this appears in the exam, blood loss. How much blood has the person lost? So you have to memorize this. Less than 750, then double the amount. 750 to 1500, then 15 to 2000, more than 2000. You have to read these 3 or 4 times. 750, double 1500, then up to 2000, then more than 2000. These are the 3 things you need to memorize from this table. Here is an example. A patient presents with severe bleeding after stabbing his thigh. Heart rate has been given 130. We know less than 100, 100 to 119, 120 to 39 and more than 140. So this patient having 130, that means 120 to 139. Which class? Class 3. We are already sure of that. Another paracetamol poisoning case. See, this is one of the things that frequently appear in the exam. A patient has ingested 30 tablets of paracetamol, 30 tablets. So this person has taken 30 tablets of paracetamol, presents to A&E with confusion and feeling unwell. IV anesthesial system was given 24 hours after treatment. Look at the duration, 24 hours after treatment. She is still confused. Her labs show pH less than what? 7.3. So this must ring a bell in your mind that you are talking about what? King's College criteria of what? Liver transplantation.
Liver transplantation.
Right. So most appropriate management, liver transplantation. Carbon monoxide poisoning. This is a small one. Just go through the causes. You don't need to memorize the causes. These are just given for hint purpose in your exam. Car exhaust, fires, faulty gas heaters, paints, a person working in a car factory, a person coming out of a burnt house, a firefighter, from faulty gas heaters at home, or a painter. All these are clues in the exam for you to diagnose what? Carbon monoxide poisoning. Don't memorize the pathogenesis. Just go through now the features. Severe dizziness, headache. Headache is one of the pathognomic features of carbon monoxide poisoning. Severe headache, dizziness and vomiting. Also any of these things, car exhaust, maybe working in a car factory, maybe a firefighter, maybe a person coming off a burnt house, maybe a painter. If you combine all these, you will be sure that this is what? This is carbon monoxide poisoning. You don't need to remember everything. Just memorize the things I have marked. Dizziness, headache, vomiting, and any of these causes. You will be sure this is carbon monoxide poisoning. Investigation of choice is carboxyhemoglobin levels. Carboxyhemoglobin levels. Okay, management. Management is this. If conscious, 100% oxygen via a tight fitting face mask. You cannot give 100% oxygen with a nasal cannula in carbon monoxide poisoning. Tight fitting face mask. All right. So you do not only remember 100% oxygen. You have to remember what? Tight fitting face mask. If the patient is unconscious, then intubate and ventilate with IPPV on 100% oxygen. All right. So remember, it has two different managements. If conscious, 100% oxygen by face mask. If unconscious, you cannot give 100% oxygen by face mask. You have to intubate. We know that any unconscious patient, we have to intubate eventually. So intubate and ventilate with what? IPPV. This is a sort of ventilation system which we usually provide in ICUs with 100% oxygen. Okay, GI bleeding. This is also a topic in abdomen chapter. Always start with IV fluids because any sort of bleeding, patient will be hypotensive. So we know in hypotensive patients, what is the initial management of choice? IV fluids. So start with IV fluids. What is important for GI bleeding is that terlipressin. This is a drug, and prophylactic antibiotics. You can just go through the names, cipro or cephalosporin. And third step is endoscopy. Fourth step, if endoscopy also fails, transjugular intrahepatic portosystemic shunt. Remember the full form, or you can just remember the abbreviation TIPS. So in any GI bleeding, initially what is the management? IV fluid. If patient has been given IV fluid, step 2, go for this medication, terlipressin, and some antibiotics. You do not need to remember the name of the antibiotics because in every hospital in the UK, they have different guidelines for giving antibiotics. So just remember that you have to give some prophylactic antibiotics. Third step, go for an endoscopy. Fourth step, everything fails, go for this procedure, TIPS.